Hello? Yes. Thank you, everyone, to come to our Entera Symposium. Let's start. In the end of the sessions, we open to Q&A, okay? I would like to invite Dr. Daniel Dziabas to the stage.
Thank you so much. I want to thank Entera and Paris for the invitation and the scientific community. Today I'm talking about the technology, the science, and the clinical application for facial skin rejuvenation with Coolfase. So I'm a dermatologist from Brazil, São Paulo, and we are here in one of the biggest congress of the world talking about aging, and we can't deny how much this market has changed in so many different ways in the past years. And we have some data. According to the Deloitte 2023, 76% of the people now prefer treatments that improve the appearance gradually instead of drastic or artificial results. They also, instead of appear young, they want to look good for our own age with authenticity and with well-being. And of course, now we are talking about more than, we're talking about preventive strategies and also corrective interventions. So we are talking about minimally invasive technologies and aging supplements and also lifestyle changes. And the preference of our patients has changed also. They want more for procedures with non-invasive or minimally invasive, with minimal pain, with short recovery times, with subtle results, and also really efficacy right after one session. And that's why the popularity of treatments like radiofrequency, microfocus ultrasound reflects the preference of these methods that respect the body natural rhythms. And while we are talking about monopolar radiofrequency, this technology was one of the pioneer devices on non-invasive treatment for skin tightening and skin lifting in 2002, with so many scientific articles proving the best results for these technologies, but with some challenges in that age, especially talking about the discomfort during the procedure and some variable efficiency. But in the past 23 years, we got some improvement in this area. Introduction of this integrity cooling system, thermal feedback system for greater precision, and also different applicators for different areas for face and body as well. But in 2009, we got the introduction of HIFU in our market, kind of technology that you can control the dip of the delivery of the energy in small spots. But we can't deny that when you are using monopolar radiofrequency, we can spread the heat, spread the energy, and you can create a more volume and a bigger area to stimulate the collagen. So we can combine these technologies and also thinking about how deep we can go with the monopolar radiofrequency. In the beginning, we thought that this kind of technology, we could just reach the deep derms. But the new scientific studies show us that we can also stimulate the collagen through the fibroseptum of the subcutaneous layer, through the superficial fascia, deep fascia, and also through the ligaments, thanks to the impedance of the tissue and preserving the fat cells of this area. So it's a huge difference and is a good option, especially for thin and skinny face. And why Coolfase? Why choosing Coolfase? Coolfase is the epitome of this evolution of monopolar radiofrequency in the past 23 years. Now we got this advanced layer cooling, exclusive dynamic cooling system that protects the derms while you can deliver uniform intense heating through the deep derms. We also got a higher precision thermal feedback thanks to the sensors that adjust the energy, guaranteeing maximum efficiency and safety. We got this comfortable all during the procedure thanks to this fractional energy system, and also a superior efficient with a shorter protocol with fast results right after one session. So with monopolar radiofrequency, we can stimulate collagen, we can increase the cellular metabolism, we also can enhance the skin support and ligaments and improve the skin thickness and density. As we can see in this video, okay. We got this patent technology with direct contact cooling. Keep the epidermis in 5 Celsius degree while you deliver the high energy through the dermis, through the fibroseptum, and through the ligaments. Stimulate the collagen, stimulate the elastin fibers, so creating this tighten and lifting process. This patent technology also guarantees the comfort during the treatment while you deliver the maximum energy approved by KFDA is 140 joules, is the highest energy with the maximum comfort. And also this kind of fractional delivered with 5 pulses of 150 to 190 milliseconds pulse time, we can guarantee even more comfort during the procedure and the highest energy delivery. So these are some benefits of Coolfase. There is no need for gas or water for constant cooling. DCC, this technology, this patent technology, guaranteeing comfort with no pain during the whole procedure. We can deliver the maximum power approved by KFDA with the highest energy delivery with the cooling system, and the effectiveness of the treatment is 1.5 to 2 times higher if you compare with the other competitors and other machines of the market. It's really a shorter procedure, it's easily to delegate, and it's always comfortable for the person who's gonna apply the device. We got 3 different tips for face, for eyes, and even for body. And what are our main indications? So we usually indicate Coolfase for facial rejuvenation, especially for skin tightening, wrinkle reduction, for enhance the facial contour. For neck and décolletage, we can lifting and firming the sagging skin, reduce the crispness, and also for body contouring, especially for postpartum or skin tightening of the arms and of the thighs. In Brazil, we do like to use Coolfase for pre-event glow, so we can provide the radiance and the firmness right after the procedure. Also, it's a good suggestion for young patients when we want preventive aging. We can combine this technology with other devices and even with injectable treatments. And also it's a good option for that patient that looks for treating skin, for tightening skin, but they don't want invasive treatment. In my practice, considering how deep we can go with the monopolar radiofrequency, we develop in our clinic this protocol. This is the main protocol that I use for my patient for the past 4 months that when I started using this technology. So we started the face use, we use 300 shots per side in the maximum level, and all our patients can go with this level with no pain. We started with 100 shots above ligaments and 200 shots spreading the whole area, 100 shots per pass in a hashtag shape. In submental area, 100 shots per side with the maximum energy. We started 20 shots above the ligaments and 80 shots in 2 passes with 40 shots per pass in a hashtag wave. And for a neck, 100 shots per side, maximum level, and 2 passes with 50 shots per pass in a hashtag shape as well. So in total, we got 1,000 shots per patient for this session. And this is our results. So as you can see, after one single session, 7 days after this one single session, we got a huge improvement in the quality of the skin of the upper face. As we can see, we got improvement of the fine wrinkles. We also lift the eyebrows and improve the quality of the skin of the eyelids. We got a tightening and reduction of the nasolabial fold and an improvement of the jawline and a tightening of the skin over the submental area. Another patient, 7 days after one session, as we can see, also a lifting of the eyebrow, improvement of the quality of the skin in the periorbital area, lifting and skin tightening of the mid and lower face, and also improvement of the jawline and the tightening of the submental area. And the last patient, 30 days after one single session, improvement in the whole quality of the skin, improvement on the periorbital area, a skin tightening in the mid and lower face, and a better definition of the jawline. So that's some reasons why I choose Coolfase for my clinic. It's a revolutionary treatment for sagging skin and increased collagen. We can improve the skin thickness, texture, and elasticity. We got a huge tightening potential thanks to this delivery energy through the derms, through the fibrocepta, through the fascia and ligaments. And also we can preserve the fat compartments. So it's an alternative for skinny and thin faces comparing to a HIFU technology. We got the largest energy delivery on the market with no invasive treatment, no downtime, one session, fast results with no pain and maximum comfort. I want to thank my extraordinary team that always with me and supporting me, and thank you so much for your attention.
Thank you, Dr. Daniel. It's always an honor learn with you. I would like to invite now Dr. Fernando Macedo to next lecture.
Hello. Hello? Okay? I'm so glad I'm speaking after Daniel, because he already said so many things that I won't have to say, and I agree with you, okay? So my lecture is kind of similar to Daniel. Some points I think are similar to everybody here that's going to speak. We like very much this technology. Is it going?
Yeah.
Okay. So, but I'll focus in my clinical cases and what I believe is really different here. Okay, so my talk is about the impact of evolution of monopolar radiofrequency. What's new? Clinical benefits, alone and in combination with other therapies. Okay, I was there 20 years ago when Thermage and Thermacool came to Brazil, and I saw this technology work. And it really was nice because it promoted rejuvenation at a time when we were using a lot of ablative lasers. And we're mostly destroying things and not constructing things. Even though we were rejuvenating with fractional ablative, it was also destroying some skin, okay? So it was really nice, but there were some problems, like he told me. It was time-consuming. The shots were very long. It took several seconds. It was really painful. And this impacted the results of the patient. So was it a success? Yes, it was. It was a big success because it brought to doctors exclusivity in treatment and also a differentiation in the clinics. But so this is the technology. It's energy, electric energy with a rapid alternating polarity. that makes oscillation of the water molecules, generating heat, okay? One of the secrets is this capacitive membrane that couples radio frequency in the three-dimensional volume, and this will happen after that. A subtle damage, shortening of the collagen bundles, inflammatory cascade, heat shock protein, everybody knows that. And finally, new collagen and tightened skin. So this is Korea, September 24. And in this picture, I have a courageous patient here. My first Coolfase patient, very courageous in Korea, in this demonstration there. And this is a very smart guy, Eddie. He's the CEO of Asterosis. And 2 years ago, when he told me that he was going to develop a radio frequency monopolar new with no pain, I believed in him. So I was there to see that. So this is what Daniel just told us. But look at this picture. We're firing the monopolar. Here is very hot. Here's the cooling system. It maintains the temperature on the surface very cool. And then we see the heating of the dermis. And that's very nice because the temperature here is maintained very cool. And the patient doesn't suffer. Finally, something that the patient doesn't suffer. It's not the only thing, but it's one of the things that they like very much. And who will like mostly? Men, because men don't tolerate. And so I have a lot of patients that are men now willing to do this technology. So the secret is here, is patented by Asterosis. And this patient tolerance makes us increase energy, use the maximum energy, and it's a very fast, virtually painless, very easy, and we'll do a bank of collagen to our patient and treat and rejuvenate them. So with higher energy, plus tolerance, plus the technology of impedance sensing that Daniel just told us, we have safety also. So we have better results, we have great satisfaction of our patient. I haven't had yet a patient that didn't like this treatment. I'm serious about that. So we're treating also body areas, but can we do the lifting and contraction of ligaments as we do with HIFU, as we do with other lasers? That's always my purpose, okay? So yes, we can do it, and that's my approach. I do overlapping of the shots. The company recommends up to 30%, but I do 50% overlap shot after shot, and I do successive passes in the same area before going to another area, okay? And I also do an even treatment. I will privilege the anchoring areas that we're gonna see here and do more shots there to have the lifting effect. So here are some of the areas. I won't have time to go through that, but we use the lateral part of the orbit, the upper part of the face, and also the lateral part of the face. And we can see here in this very beautiful schema that we can see the true and false ligaments designed under the skin here. And here are the areas that I privilege. I do more shots in the lateral part of the orbit, upper part of the face, and lateral part of the face. And here we can see the ligaments and the muscles and the connection to the bone, or the skin connects to the bone or the muscle. Right, Daniel? Okay, so this psychologist from Harvard, he told us in the last century already that the body can influence our mind and our feelings. And we see that every single day as dermatologists. We do that to our patients. So Coolfase has not just the lifting effect that they can see, but it has also the sensing that the skin is tighter. So that's a mind changing, a mindset changing for the patient. And then he will believe in that all that talk about collagen. Oh, the collagen is going to come, it's going to get your skin better. Because he's seen something. And they're always smiling after the treatment when we show half of the face treated. Like that. And we see now some of my facial marking, where I'm going to do more shots. Those are my protocols. I do less shots than Daniel. about total to 600 to 680 shots for face and neck. But I will do some anchoring areas, and I think that works very well. So this is the immediate effect. Very beautiful women. And we can see she's smiling with her eyes, and she has a lifting effect and a very nice contraction of the skin. And please don't take photos of my patient. And we'll see some of the patients that I have treated in 65 patients in 3 months. But I had 1 month of vacation, so mostly in 2 months. Different ages, skin color, quality, thickness, different approach, but similar effect in everybody, okay? So this is my dermatologist assistant, and she's also smiling with her eyes. We see some nice lifting effect, opening of the eyes, reposition of the upper third of the face and the lower third of the face, contraction of the skin, immediate lifting effect, okay? And we see that in a lot of patients. So look at the contour, how it got better, an immediate effect, a tightening effect, because we start tightening, not here, we start on the upper part of the face. Another patient also smiling with her eyes, very satisfied, and also some contraction, better contour, opening of the eye, a heavy face, that's not so easy to do it. And look at when we see this picture, a reposition of the whole face of the patient. Very difficult to treat, very thin skin, asymmetrical women. Well, she's still asymmetric, but both sides got better. We got opening of the eye, contraction of the skin, a lifting effect. So we can do that to every single patient. Heavy face, thin skin, older patient. And when we treat thin skin, we can also, besides looking to the lifting effect, we can also see an unfolding of the retids. It's like unwrinkling the patient immediately, and then after that, it will get better. Of course, we're not having collagen here. We have contraction of the skin, okay? Very thin skin, difficult to treat, nice contraction, lifting effect, unfolding the wrinkles. She's still red there. Okay, so this is a week after, and we can also see some lifting effect, but we can see now a little bit of a skin quality already, like Daniel just showed us. See, it's like we are unfolding and making it very smooth, the skin. Okay, what happens then? Does it stand with time, this effect? I tell my patients, in 2 or 3 months, remember me. Because when people start saying that you're looking good and your skin is looking good, it's not the skincare that you used last week. It's my treatment. So this what happened. Before the treatment, immediate effect, 90 days after. She kept on going better. She kept on going better. And you can see the lifting effect also kept on getting better. So a total reposition of the face with just 1 treatment. That's really nice, and no pain. Another patient, she told me I changed her life. She had never done anything. She works with me. So I done this procedure, and people started saying that she looked prettier, that she was nice, and she even got better at her job in my clinic. So very nice effect, and you can see the contour here. I have to point there, yeah. Okay, very difficult to treat, thin skin, laxity. What we see here is a redensification of the dermis. This is a 3 months, so we have a lot of collagen there. So see what happened to her. She looks prettier, she looks nicer. Okay, so why Coolfase became top treatment in clinic in just 3 months? Almost painless, very fast. We can do this wow effect. It's a mindset changing, enhances patient satisfaction, and it's part of what I call the youth pill protocol, the white pill. It's a combination, personalized annual program, and we combine lasers, technologies, biostimulators, exosomes, everything. But I always choose something that do this wow effect, so the patient will believe in what I'm saying about bank of collagen and all that. And if we do repetition, recurrence, people will start looking younger, and then they probably stop aging. It's what we call the quiet beauty. So for me, the Coolfase is the spring of the mattress, okay? It's like we're sleeping in a very nice mattress, and you can add other things so your sleep will be better. But it can be combined with everything we do, peelings, IPL, lasers, other radio frequency, HIFU, injectable biostimulators, fillers, threads. I suggest that you do always the Coolfase first, and then the other procedures. It can be in the same day, okay? And this association probably will enhance the redensification of the dermis and the lifting effect. But my patients here, I showed you, is just the Coolfase because I wanted to see the power of this technology. And last, here is where I studied lasers in 1998, Hospital St. Louis, and I always invite dermatologists to know, to get to know the Museum of Wax Molds. It's a World Heritage Site. It's very interesting. It's inside Hospital St. Louis, and the Masters of France of Dermatology made these wax models of a lot of disease of dermatology. Thank you very much. See you in São Paulo in April.
Thank you, Dr. Macedo. Your experience and knowledge are impressive. For the third lecture, I would like to invite Dr. Daniel Boro.
Hi everyone. I'm the first Brazilian patient with Coolfase. And my presentation, please. Oh, okay. Okay, yeah. And I want to know from you, do you know how to customize treatments with a monopolar radiofrequency? It's a good question, and I'm Daniel Boro. I'm a plastic surgeon from Brazil, and today I will share with you the Achieving Excellence, Optimizing Coolfase Results with Advanced Treatment Protocols. But the first question is, when do I recommend a Coolfase treatment, a monopolar radiofrequency treatment? Let's remember the layers of the face. The first layer is the skin. Then we have a superficial subcutaneous tissue, muscle, deep subcutaneous tissue, and bone. And which layers does Coolfase treatment react? Only two, skin and superficial subcutaneous tissue. As we know, the frequency of Coolfase technology is 6.78 megahertz. When the frequency is higher than 2 megahertz, we only deliver a superficial treatment, a skin treatment, only up 3 millimeters. If we want a deep treatment, we have to use a technology with a low frequency, lower than 2 megahertz. And the good question is, how do Coolfase treatments deepen to superficial subcutaneous tissue? For this question, my answer is the ligaments. The ligaments are a structure that structure our face. And we have in our face the true ligaments and false ligaments. The true ligaments are those that have a deep component to attach in the bone and superficial component to attach in the skin. So the true ligaments connect all layers of the face. When we talk about the false ligament, is a structure that connects a deep layer with a superficial layer, but not all the layers of the face. When we treat our patient with a Coolfase, the radial frequency is conducted through the ligament septum and achieve the superficial subcutaneous tissue. And an important question, if achieve superficial subcutaneous tissue, does it consume the fat? And not. We must remember that the fat is insulating. And to consume the fat with a monopolar radiofrequency, we have to use a technology with this combination, high potency and low frequency. High potency higher than 700 watts, and the Coolfase has 140 watts, and a low frequency lower than 2 megahertz, as I told you. So what happens with a Coolfase treatment? A structure. We can structure the superficial component of the ligaments. So to understand this mechanism, I brought for you this case. She's 58 years old, and her main concern is about her tired look. Her eyelid sagging, eyelid bags. And when we analyze her upper third of her face, we can see that she has an eyebrow ptosis. The ideal position of eyebrow is 1 to 2 millimeters above the superior orbital ring, and the female patients, we have a higher part, the lateral part is higher than another part, between the lateral line of the iris and lateral canthal. And we can see excess skin in her upper eyelid, and in her lower eyelid, we can see a laxity and orbital fat prolapse. This orbital fat prolapse is due to the aging process. And the skin, the muscle lost the tone, and we have to improve this tone. The skin, we can improve this tone with a collagen stimulation procedures. When we continue analyzing her case, her lower third, we can see I started to have jaw by a sagging of the skin. So, what's goal with her treatment? It's structure. Structure her face. I want to treat her sagging with a collagen stimulation. The Coolfase is the best combination because we can structure the superficial component of the ligaments and induce the collagen stimulation with a radiofrequency technology. Before I show you her treatment, we have to remember the ligaments line. And the first point is the junction of the temporal frontal crest and lateral orbital ring. Is a temporal adhesion. The second point is a lateral orbital thinking. Is component of orbital retaining ligament. Is a true ligament. Third point is a zygomatic ligament, and it has a main component, a zygomatic cutaneous ligament, is another true ligament, and the last one is a mandibular ligament, is another true ligament, the position anterior of the jaw. I started her treatment with a brow lift technique, with a facial tip of the Coolfase in 4 passes, 3 times in level 8, 1 time in level 5, with a 60 shots per side. And we have to remember this region, we have a thin skin and thin superficial subcutaneous tissue. If we use a high level, level 10 for example, we can deliver a painful treatment, so be careful. In lateral canthal, I use 4 passes, 3 times in level 8, 1 time in level 5, 40 shots per side of facial tip of Coolfase. And the lower eyelid I shared in 3 portions: pre-tarsal portion, pre-septal portion, and pre-orbital portion. The pre-septal and pre-orbital portion, I used the facial tip of Coolfase with 5 passes, 3 times in level 8, 1 time in level 6, and 1 time in level 5, 50 shots per side. My goal with this is to structure the superficial component of the zygomatic cutaneous ligament and the orbital retaining ligament. And the pre-tarsal portion, I use the eyelid tip of Coolfase with in 4 passes, 3 times in level 8, 1 time in level 6, 25 shots per side. So for her periorbital region, I used 150 shots per side of facial tip and 25 shots of eyelid tip. For her mid and lower third, I'd like you to pay attention on the pre-jaw area. This is an area that undergoes resorption with aging process in the most patients. And we have to remember the anatomy of this area. And Follow Sandulescu is an Australian plastic surgeon. He shared this mass in 4 types. And the perioral region, we have is mass type 2. And this is mass type 2 has a septum that features is perpendicular of the skin and thick and short. So it's a strong ligament in this area. If you use a high intensity and high level with Coolfase, we can enhance the resorption sign because we strong the superficial component of the ligaments, mainly in heavy-faced patients. So be careful. I used for her a facial tip in 5 passes, 3 times in level 10 in different directions, and another in level 8, and then level 6. 40 shots per pass per side, 200 shots per side of facial tip of Coolfase. And I deliver this result after 5 days and after 45 days. We can see that we treat her tired look, we improve her skin quality. In this position, we can see that we structure her face. Her eyebrow is higher than before. We can see a less excess skin in her upper eyelid. We treated her laxity and orbital fat prolapsed, and we can see this in another side of her face. And when we analyze her lower third, we can see that her jawline is more shaped than before. And when we give a zoom in the pre-jaw region, we don't see the redundancy of the skin because we treated her sagging of the skin with a radiofrequency technology. When we see all the face, we deliver for her a lift effect and a reposition of fat pads because all the tissues of the face are connected. So when we structure the superficial component of the ligaments, we reposition the fat pads. Coolfase, so structure our face, induce collagen stimulation, and deliver for the best for our patients. Coolfase treats with precision and efficacy. Thank you very much.
Yes, please. Thank you for an exciting presentation. At last but not at least, I would like to invite Dr. Fernanda Nunes to the stage.
Good afternoon, everyone. I'm Fernanda Nunes. I'm a dermatologist from Brazil. And let's wait for my class. I'm a dermatologist from Brazil, and I'm very happy with Entera's invitation to talk about this device that has surprising me with its results every single day. And what Fernando talked about the results of patients and happiness that they show us after the treatments is really amazing. Isn't it, Fernando? Okay. So, I'm Fernanda Nunes again. Of course, we're going to talk about Coolfase, but first, I want to invite you guys to watch one episode of a famous Brazilian series. And it's with Valesca Bruzzi, a famous person in Brazil. So the year is 2017, sorry. Valesca is a digital influencer, a famous digital influencer in Brazil. And she teaches how to create content for social media. And she was a bodybuilder. A year later, Valesca got pregnant, and he had her first child. 2 years later, she was back to her previous body. And then, when she got thin, she got pregnant again, and she got pregnant again. So, our friend Barbara is saying, me in my real life. So, this is real life. That's why I'm showing this to you guys. So, after the 3 pregnancies, she looked at the mirror and thought, oh my God, I want my previous body back. So, she lost weight due to use of Ozempic. She did a liposuction. And then she came to my clinic saying that she wanted to treat laxity. And this is the beginning of her story with Coolfase. So let's talk to Coolfase for the body, my most effective protocols that deliver wow results. But first, why Coolfase? It's easy to talk why Coolfase after Dr. Dziabas and Dr. Fernando Macedo and Dr. Boro talking to you guys because they already told you guys everything about Coolfase. So Coolfase is a monopolar radiofrequency that delivers 140 watts that induces collagen contraction, collagen deposition, and remodeling, and a super heat tightening. It has constant cooling of 5 degrees and a short energy control that promotes excellent tolerance among patients in terms of pain. And it is no ablative, so there is no downtime. And here I have a paper of Dr. Jason Burns that he talks about this imaginative tightening that, that monopolar radiofrequency causes in the tissue, and about the remodeling of new collagen. And he says that when he treats, he prefers to do more passes using moderate energy to promote this structure and long-lasting collagen. And there is a graphic that shows that he uses moderate energy with more passes. So we already know that. When you go from level 1 to 6, we increase our power to 140 watts. And we reach maximum energy that we're going to treat in the optimal way, our fibroreceptor. And we go to level, when you up to level 7 to 10, we maintain our power to 140 watts, but we can increase the exposure time of the tissue to the radiofrequency. And what about laxity? We associate laxity with low fat percentage, with body changes after pregnancies, with weight loss, and with rapid weight loss, particularly chronological aging, and due to use of GLP-1 receptor analogs. And we can classify laxity in 4 grades. Grade 1, normal skin. Grade 2, mild sagging skin. Grade 3, moderate sagging skin. And grade 4, severe sagging skin. And our best patients are grade 2, mild sagging skin. Our patient is grade 2, she has mild sagging skin, and she is the best type, the best kind of candidate. And let's talk about her plan of treatment. So what I do is to determine the laxity area. Then I use the tip as a necessary to mark vertical lines, and the tip to mark horizontal lines that we were gonna work. For her, I used level 8 with cooling 5, total of 5,605 shots. I worked in vertical lines, oblique lines, and horizontal lines, in around 6 to 7 passes in each direction. Let's remember that the most important is to hit the tissue and so let's remember that press the tip against the skin, listen to the sound of the shot, wait to the end of the sound of the shot, and then proceed to another shot. And the treatment is totally, we can customize from each patient. So if you think your patient deserves more oblique direction, for example, you may persist on oblique direction. And let's see this lovely result of her treatment before the session. 2 months later, she did her second session, and the third result is after the second session. Look at here her abs on the third video. We can see more muscles definition because of the skin tightening that the device provides. And look her lovely result. So many people say that radiofrequency monopolar has a meditative tightening, but it's not long-lasting. And with Valesca result, we can see that she has a beautiful and lovely and long-lasting result. And what about Coolfase in dermatologic ultrasound? We can see immediate reduction of 0.04 centimeters after the application that is consistent with the skin tightening of the device. And here I show you another case of a super different patient. She has more fat in her abs, but even though she is not the best patient, I want to show you her case because we have a beautiful result. And so we can combine this kind of patient with microfrozen, with Entera to improve her result. Here we used level 8, cooling 5, 685 shots, horizontal, vertical, and oblique line. In this patient, we performed 7 passes. A beautiful before and after session. And let's talk about area in the body that patients complains a lot. And we do the same strategy. We determine the flexity area. We use the tip as an accessory to mark vertical lines, horizontal lines. In this patient, we used level 8, cooling 5, 245 shots for arm, horizontal, vertical, and oblique lines, and let's remember she has mild to moderate sagging. Let's remember to press the tip against the skin, to listen to the sound of the shot, to wait for the end of the sound, and then to proceed to the another shot. And let's see a lovely before and after result. This is immediate, but we can see the improvement about 2 or 3 months. And about the colletage, we can use Coolfase, and I'm really in love with its results. We determine the rouginess area, then use the tip as an accessory to mark vertical and horizontal lines. In this patient, I used level 6 with cooling of 5, 280 shots for total, horizontal, vertical, and oblique lines. And let's see this beautiful result. The improvement of rouginess, the improvement of glow skin, and of course we can combine with other technologies or with injectables in the same day of the treatment. And this is the kind of message that we receive from our patients. She says she is amazing. She has a very great improvement of her body. And she says, I'm her everything. So she was super, super, super happy. And this is a true story. This is the story of our patients that came to our offices to treat laxity. And let's start to look the body as the new face. We are in the generation of sagging due to rapid weight loss. In my clinic, every single day, I have contact with patients that use medications or that do surgery to weight loss. Patients see quick results with maximum comfort and minimal recovery time. So Coolfase is my first choice for standalone use or in combination to treat laxity. Merci beaucoup.
Thank you, Dr. Fernanda Nunes. What an amount of competence. We have a few minutes for Q&A. If you have any questions, let me know. Any questions for one of doctors?
Hello, my name is Dr. Evi. I'm come from Indonesia. I have 3 clinics. Here's the thing. Our typical patient back in my country, they feel painful, so they can feel a good result. And maybe if you know Oligio, they are so famous back in my country, Indonesia. Is it the same mechanism with the Coolfase? The mechanism work on.
The cooling system is
Yes,
different,
or different.
but of course they are competitors. But as we showed in our presentation, with using Coolfase, we can ensure the highest energy, the highest power we can deliver through the derms is 140 watts or joules. But we can do that keeping the epidermis in 5 Celsius degree during the whole pulse and during the whole treatment. So your patient can stand the highest energy, the highest level with so much comfortable. I've tried Oligio, and I also tried von Neumann before the purchase of Coolfase, and I decided Coolfase because I couldn't stand the highest energy of Oligio, and I couldn't stand the high energy of von Neumann because it's so painful, especially when you compare the system of cooling. The Oligio used gas, isn't it? It's gas? Gas. So you feel the right breath of gas, cool a little bit, but then you feel the heat power during the pulse. So for me, it's not so comfortable. And as I showed in the beginning of my lecture, nowadays our patients, they do want good results. So if you can use the best energy of your device, is the best way to deliver these results, but they do want comfortable. And if you use Oligio in the lowest level, you're not gonna deliver 140 watts. So you're gonna deliver it lower energy.
I also tried Oligio, and I agree with Daniel. You cannot reach the high levels with the same comfort that we see in Coolfase. It's very interesting when you receive Coolfase treatment, you feel at the same time heat and cool. It's weird, you know, and that really works. That's really the secret of it. And so we can put high energies, do overlapping, do like I do overlapping sequential passes, and we enhance temperature, but it's still comfort. So I think it's a little bit different, especially because of the cooling system that makes it. That's a big secret here.
What I have been seeing in Brazil is less security and more complications with Oligio, like burns. So, like Dr. Dziabas and Dr. Fernando said, we see a superiority with security with the use of Coolfase.
I can share my experience because I was the first patient when they introduced the Oligio in my clinic, and I've tried as a patient, and I got burned. Yes. So, of course, it was a superficial burn, but it was really uncomfortable. And your patient is not going to like to see a micropapilla for like one week to heal. So it's like comparing an air conditioner and just a ventilator. It's a completely different cooling system.
We have to remember the monopolar radio frequency. We have to deliver the high potency. So we have to do a cooling enough to deliver the best.
Thank you so much, doctors, because I was considered to buy this Coolfase, but the main problem is back in my country, Oligio, they hire a famous artist to advertising their products. So yeah, but definitely after this one, after this seminar, I will buy this machine. Thank you so much.
Welcome.
You did a great job.
Any other question? It's okay.
Hello. It was a pleasure to see you guys from Brazil, the same culture of me, and doing lectures, amazing lectures. I have an experience that's similar that then guys told you. I have a patient from China. She was used to do thermage, and after she said to me that I've already done one equipment that's similar than thermage, but I suffered a lot and I got burned, and there was the competitor that's called Oligio, and she came to my clinic to try to find another machine that could do the same result of thermage, but without burns and without suffering. And she was the first patient that we had done the Coolfase, and she was impressed. She said, Dr. Bruno, I don't know if I can through in this technology because I didn't suffer as like Oligio and like thermage. And she was impressed, and we invited her to do more sessions to analyze the results. So my experience, and I can see about this patient, that we can get the results, we are waiting for the results, and she didn't suffer like the other technologies that is called similars.
Thank you. We have time just for one last question. Anyone? Okay. So thank you very much for your audience, and thank you once again for you, doctors. It was a pleasure, it was an honor to learn with you.